Certainly, right now, only in the US, this is an option for patients who are cisplatin-ineligible. Places like Europe and UK and Canada will wait for overall survival signal before it becomes available or approved by the regulatory authorities. So right now, I would say, for patients who are not eligible to receive cisplatin, they have the option of EV-Pembro based on the phase 1B, phase 2 study. And there's also level 1 evidence from gemcitabine, carboplatin, followed by vedotin maintenance. So really, it's great to have multiple options for patients in this setting. And depending on their comorbidities and other factors, physicians can decide what to offer. But this is certainly an exciting option for these patients as well.